This video will demonstrate the care of a PICC using aseptic non-touch technique, or ANTT. A PICC is a catheter that enters the vein in the upper arm and travels along the vein into the superior vena cava, which is the largest vein in the body just above the heart. There are various types of PICCs available, however the general care and management will be similar for all PICCs. They need to be flushed and dressed routinely once every 7 days. Additionally, you should always change the dressing if it's soiled and always flush a PICC immediately after use. Dual lumen PICCs are also available and both lumens need to be flushed. The first step is to observe for any signs of complications. Observe the exit site for signs of infection such as redness, discharge, pain, and if the patient has a pyrexia. Ask the patient if they have experienced rigors during any previous PICC flush. This is a sign of a catheter infection and needs to be managed urgently. Also observe for any pain, redness or swelling from the shoulder to the fingers, which may indicate a blood clot in the vein. To flush and dress the PICC, you will need the following equipment: a plastic tray, alcohol gel, non-sterile gloves, sanitizing wipes, 10 ml of normal saline 0.9%, 10 ml syringe, a blunt needle, a disinfection wipe for medical devices with chlorhexidine 2% and alcohol 70%, for example a Clinell, a needle-free connector if it needs to be changed. This should be done weekly. For the dressing, a transparent semi-permeable polyurethane dressing such as Tegaderm or IV3000, Chloroprep single-use applicator which contains chlorhexidine 2% and alcohol 70%, and forceps. This is optional. You first need to decontaminate your hands, clean the tray with sanitizing wipes and leave to dry. We will be referring to key parts and key sites throughout this video. Place the equipment in the tray. Don't remove items from the packaging at this point. Put on non-sterile gloves. If you have a pre-filled syringe, open the packaging. You can place the syringe back into the tray as the cap protects the key part, which is the tip of the syringe. If you don't have a pre-filled syringe, open the syringe and lift the packaging over to expose the plunger of the syringe. Open the needle, ensuring that you are protecting key parts from contamination. Draw up the saline using the needle. You should not place the syringe directly into the saline vial. Remove the needle, making sure there is no contact between your gloves and the syringe tip. Dispel any air. You will now need to protect the end of the syringe. You can place it back into the packaging. Another way to protect the tip is to use a red end connector placed onto the tip of the syringe. For a routine flush with saline, there is no need to establish a blood return. If you are using a PICC for any other intravenous fluid or medication, you will always need to make sure that you can obtain a small blood sample from the PICC prior to use. If the end of the connector does not need changing, clean the very end of the needle-free connector. Open the Clinell and clean the end connector with a portion of the clenell that you haven't touched. Clean vigorously for 15 seconds. You must then make sure that the end of the needle-free connector has dried. Once it's dry, hold on to the end of the pick to ensure that there is no contamination. Take the prepared syringe and place firmly into the end connector. Flush using a turbulent positive pressure flush. This is where you push and pause the flush, and at the end, when you have 1 ml left, withdraw the syringe, removing from the end connector whilst still flushing. If the needle-free connector needs to be changed, take the disinfecting wipe and place in your hand. Remove the old needle-free connector and discard. Open the wipe and clean the end of the pick with a part of the wipe that you haven't touched. Flush the pick line. If you have a pick with a clamp, open the clamp, flush, and as you come towards the end of the last mil, you need to clamp the catheter as you flush. This instruction will demonstrate how to dress a pick with a Securicath. This is a security device that is placed during the insertion of a pick. It has 2 anchors that rest beneath the skin to prevent migration. Decontaminate your hands, put on non-sterile gloves, clean the plastic tray with sanitizing wipes and allow to dry. Remove your gloves. Place the equipment unopened into the tray. The dressing, such as Tegaderm or Ivory 3000, the Chlora Prep, and the forceps. Put on non-sterile gloves. Carefully remove the dressing, taking care not to touch the exit site to prevent contamination. Hold the Securicath to prevent it from pulling. Discard the dressing and remove the gloves. Decontaminate hands and put another pair of non-sterile gloves. forceps can be used to clean any debris from in between the PICC and the metal part of the Securicath. Open the ChloraPrep, hold upside down and click the two plastic wings. Fluid should now come into the sponge. Clean the exit site with the ChloraPrep thoroughly for 30 seconds and leave to dry. To prevent soreness under the Securicath, lift it up from the skin to allow the skin to dry beneath it. Allow to dry. When completely dry, loop the catheter if it's long enough and ensure there are no kinks. Place the dressing over the exit site and the PICC. Some patients will have a Bayer patch on the exit site. This is a small disc that allows the release of chlorhexidine antiseptic over a 7-day period. A Bayer patch will need to be changed weekly or if soiled. Always remove a soiled Bayer patch and replace. You will need to use sterile gloves for this part of the procedure, as it will be difficult not to contaminate the key site, which is the exit site. Open a pair of sterile gloves onto the tray and place the new Bayer patch onto the dressing pack gloves. Put on a pair of non-sterile gloves first and clean the exit site with the ChloraPrep thoroughly for 30 seconds and leave to dry. Allow to dry. Put on the sterile gloves. Take the Bayer patch and place directly on the exit site. You may have to ask the patient to lift the PICC line up at this stage to prevent contamination. Make sure that the Bayer patch has the writing up, the blue part up. Place the dressing over the PICC line. Ensure there are no kinks. Place the dressing over the exit site and the PICC.